Hi guys, I'm Dr. Andrew Iraniha from Surgical Oasis Institute. I'm a board certified general surgeon and I have dedicated my practice over the last 2 decades in Southern California to body contouring, hernia repair, and as part of the body contouring, I perform breast surgery, including breast augmentation and lift. And today I will go ahead and review what you expect before and after the surgery in detail. So let's start from the time that you come into the office for initial consultations. Initially, you fill out some paperwork which are extremely important to determine who is the good candidate for this type of operation. First, you fill out the health questionnaire, and we talk about your past medical history, your past surgical history, the allergic reactions and the type of medications that you're on. And then we also recommend the patient to bring pictures of the type of breast that they are expecting to have, and as far as the size and the shape. And then we perform a very comprehensive physical exam, including the chest measurements and measurement of their breast footprint. That basically gives us a very close idea of what size of breast implant we need to put in, or what type of lift with or without breast implant we need to perform. So we determine whether the patient is a good candidate for surgery or not, depending on their medical issues, their expectations, and at the end we go over technique of the operation in very detail. Now let's talk about the pre-operative workup. What are the tests that needs to be done prior to the operation? So in general, when we operate on a breast, we want to make sure that the patient does not have any current issues for the breast. So for people who are over 40, I perform an ultrasound and mammogram to make sure that the patient does not have any active disease prior to performing a breast lift or augmentation. Obviously, if the patient has a very strong family history of cancer, even younger patients above 30, they have requirement to go over these type of tests prior to the surgery. Now, there are other tests that we do prior to surgery, including blood work, EKG, chest X-ray, depending on their age. And sometimes we even need medical clearance from their medical doctor prior to performing the operation, especially if they have medical issues like heart problems, diabetes, or high blood pressure. If they have diabetes, they need to have a very tight blood sugar control, and we discuss that prior to the surgery and follow up with the blood work. If they're a smoker, we definitely want them to at least stop smoking for 2 weeks prior to the surgery, and even continue not smoking for a couple of weeks after the surgery. And obviously, if they're on blood thinner or some supplements that thin their blood, we recommend them to stop that 2 weeks prior to the surgery to decrease the risk of complication, including the bleeding after the operation. Now, the day before the surgery, we ask the patient to eat a very light dinner, and then nothing to eat or drink after midnight, and wake up in the morning, take a shower with a HEPA cleanse, and then wear a very loose outfit, come to the surgery center on time. And then in the morning before arrival, if they are on essential blood pressure medication, they need to take that with a sip of water. If they are diabetic, since they didn't eat or drink after midnight, we recommend them to hold off on their diabetic medication. Now, the day of the surgery, when you come into a surgery center, we ask you to fill out some forms. The most important ones are the health questionnaire and the current medications. We would like to know if there have been any changes since the time of initial consultations in your medical issues, and also the medications that you're taking. And obviously, if there's any difference since then, you need to inform us so we can act on it. the other forms that you have to fill out is obviously surgery consent form and anesthesia consent form. We go over the operation, risks and benefits and alternatives again in detail, and you will meet the anesthesiologist and he will go over the detail of the anesthesia part of the surgery, and then you will sign the consent form, which is the permission you give us to do the surgery. Because we do pre and post pictures or videos, and sometimes we even do pictures during the operation, we want you to fill out a consent for photography. We ask the patients if they have any advance directive, and they need to sign the appropriate form for that as well. As I say, you will meet the anesthesiologist that day. Majority of these type of operations, including augmentation and also breast lift, will be done under general anesthesia, which is the total anesthesia. And we also give the patients during the surgery local anesthetic, which helps for after the care and after surgery pain control. But most of the patients go under general anesthesia for the surgery. All the patients, they will get IV access in the holding room before they go into the operating room, and all of these patients going to be done with outpatient setting, so they get the operation and they go home the same day. Now what happens right after the surgery is that patient will come to the recovery room and stays there for 1, 2, 3 hours, and really depends on the type of operation that we did. For breast augmentation, the recovery is much quicker. Breast lift is a little bit longer, but we will have some criteria before the patient able to go home. They all need a ride to go home. They can't drive themselves back, so you need to make sure that you arrange someone to come in and pick you up. The patient gets a breast binder and give you the very full instructions of how you take care of them. Most of the patients, they would not have any drain, so it's just a matter of dressing in the breast binder. Patients after the surgery in the recovery room, they're going to have some nausea, a little groggy and tired and weak, and sometimes they have a little bit of difficulty urinating, and also sore throat after the surgery, very common, but all of those will gradually disappears a few hours after the surgery. Now, what to expect initially, the first 3 days, it really depends on the type of operation we did. Obviously, the breast augmentation has a much faster recovery, and breast lift has a little bit longer recovery. But overall, the first few days after the surgery, patient will go through a little nausea, a little discomfort, a little being drowsy and dizzy and groggy. And some of the patients would have a little bit of constipation, lack of appetite. Those are all very normal, and majority of patients after 2 or 3 days, all the symptoms will disappear. Sometimes they feel discomfort in their breast, a little bruise, a little numbness, and changes in the skin sensations, very, very common. Obviously, if they develop significant amount of pain, which is very sudden and associated with a lot of enlargement of the breast, and that will be abnormal, that they need to call us. But a little bit of swelling, a little bit of bruise, a little bit of numbness after the surgery, extremely normal, and they usually go away. So my recommendation to my patients always is that they don't expect that they will be 100% in a few days, and the recovery is really gradual, and every day they need to expect a little bit improvement. Again, what to do initially, they need to eat a very light dinner, and they should have plenty of liquid. They need to walk and take deep breath. Those are very critical. After the surgery, they can leave their dressing on. Usually I see them the first day after the operation, and I change the dressing and go over the whole instructions again. Obviously, we will examine the patient to make sure that they don't have immediate complications after the surgery, and if everything's okay, I do redress the patients and then give them more instructions for aftercare. Normally, I see the patients 1 or 2 weeks and again 6 weeks after the surgery for follow-up. Patients with the breast implant and also lift would have a long-term follow-up every 6 months to make sure that they don't have any issues with the breast implant. So we go over the breast binder and how long they need to keep that. Majority of times I recommend them to keep the breast binder for at least 2 weeks, and after that we change that to a little lighter breast binder, and they need to wear that for 6 weeks, and that's the time that usually the wound is healed completely, and they need to be able to start exercising and doing activities, and then they can use the sport bra. So one of the major questions that patients ask always is how long is the recovery. So the recovery really again depends on the type of surgery that you had. If you had a breast augmentation compared to breast lift, the recovery is much faster. But in general, people should expect very tough discomfort for the first couple, 2 or 3 days, and then by 2 weeks, majority of patients with the breast augmentation, they feel great. For patients with the breast lift, it usually takes between 2 to 6 weeks for them to recover completely. At that time, a patient would be able to go back to exercise and resume their normal heavy activity. Usually if they have a bruise, it usually takes 2 to 3 weeks to go away, and also swelling usually takes 2 to 6 weeks to completely improve. So I hope this video was helpful. If you like my video, please like the video, and also you can subscribe to my YouTube channel and look at a variety of videos that I have for different subjects and procedures that I do. And if you need further information about breast augmentation or breast lift, please contact my office for free consultations at 949-646-8444.